At least 30 people have died from a cholera outbreak in Nigeria. 65 cases have been confirmed from January 1 to June 11 across 96 local governments in 30 states. The Nigeria Center for Disease Control and Prevention has alerted the public of the increasing trend of the disease across the country as the rainy season intensifies. In Lagos State, 60 hospital admissions have been recorded, including deaths in 48 hours. A total of 1,141 suspected cases have been recorded with 10 states. Now, these states include Bayelsa, Zamfara, Abia, Cross River, Bauchi, Delta, Katsina, Imo, Nasarawa, and Lagos State. Joining me now is Sebastian Yennan, who is the director of the Sub-National Support Department at the Nigeria Center for Disease Control and Prevention, where he's also lead for Cholera Technical Working Group. Thank you so much for joining us on Newsnight.
Thank you for having me.
Yeah, we do understand that the outbreak started since January, and this is June, about 6 months into the year. Why has it taken this long to alert Nigerians as to the clear and present danger of cholera?
Okay, actually, we work with threshold levels, and it's actually anticipated that with the onset of the rain, we will have upsurge like this. It's not that we have not been having cases. Right. You just said that on record now, about 30 states have had cholera cases.
Of the 36 states?
Yes, of the 36 states and FCT since January. So we work with the epidemiological calendar, which presently we are on the week 24. So from 1st January to date, in fact, the figure has increased. So we have as at now 1,213 suspected cases, 74 confirmation from 99 local governments of 30 states. So with Lagos leading in the last 1 week, or within this week now that I'm talking about. So it's something that has been with us since the 70s. You can recall we had a major outbreak of cholera in history in 2021, where we led with over 106,000 suspected cases in Nigeria, over 3,000 deaths as at 2021. Yeah. So comparatively now, if you look at what we have now with 2023, we have 62% reduction. So a lot has been going on into the issue of prevention and control of cholera, which is predominantly related to provision of water, sanitation, and hygiene infrastructures. Right. And you know that this is a subnational level intervention that needs to be in place. We have been working in consonance with the states. That's why we deemed it fit in 2022 to actually create a department called Sub-National Support Department, which I led. It has brought us closer to the states and local government, interfacing with the Governors Forum, where we are actually telling them that they have a lot of stake to do.
What in specific terms? I mean, what specific strategies are you asking the sub-nationals, the states, to put in place to you know, not just prevent, but at least to check the, you know, seriousness of this outbreak?
Yeah, first of all, what are the drivers of cholera? Right. Inadequate wash infrastructure, like I told you. Then the challenge of open defecation. Recall as far back as 2018, the former president, Muhammadu Buhari, actually declared state of emergency on open defecation. Yeah. We are working towards the deadline of 2025, even though we might need to extend it, but at least there's political will in that direction. So
Nigeria is top 2, if not the number 1 in open defecation.
Yeah, really but the good thing is that there is political will now. We are monitoring trends. We are engaging with the critical stakeholders to see that this is actually nipping the bud. Well, you also look at the issue of climate change now. So some of these things happening now is related to the flooding. Right. So it's a disease already associated with the rural poor, economically downtrodden among the societies. So we know that issues of poor infrastructures, open defecation with the onset of the rain, there will be contamination of water sources, available foods, whether it's cooked food or raw food.
Yeah.
So these are the drivers that are bringing this cholera to the upstream now.
So at different levels, there must be a response strategy.
Yes.
Let's start with the individual level.
The individual level is around personal hygiene, is keeping your environment safe, hand hygiene, as simple as making sure that you cook your food and cover it properly, your water, store it properly. You have toilet facilities, you know. You actually maintain this personal hygiene and environmental hygiene is better for you.
The same approach to many other outbreaks, whether it's Ebola you're talking about, whether it's COVID,
yes,
and what have you.
Yes.
Hand washing is the most basic.
Yes.
Right. So at the state level, and I'm just thinking aloud, if, I mean, you say the rainy season is here.
Yes.
Rains fall in different parts of the world.
Yes.
In the developed world, you know, they have the rains.
Yeah, but there are
But it's not a concern. So which means the states need to intervene in terms of making sure that basic infrastructure is in place to help the individuals, you know, protect themselves from cholera. Yes,
so that is fundamental.
Right.
Because the disease is transmitted from food, from feces, from the finger, you know. So if you look at the one that is related to your own personal hygiene and you get it fixed, then the next thing is we move to the community, then the government. What is the responsibility of the government? What is the responsibility of the community? The community should continue to sensitize the populace that these are best practices that we should adhere to, and these are the bad practices that we should do away with. They should also try to make sure people, you know, produce toilets in their homes. Even here in the FCT that we are talking about, some communities actually don't have toilets, and some are culturally related. So what our sensitization is the community doing before the government will even come into play?
Isn't that where NCDC, your agency, comes in?
Yeah, we do. But actually, it's a subnational level intervention. Right. Yeah, the NCDC is a federal government entity, but we actually have risk communication and community engagement units that interface with the states. IAC materials are developed, jingles are aired both in English and local languages. But sustenance of this risk communication and community engagement is actually the responsibility of the lower level government. So we interface with subject matter experts, development partners to develop this technical content. We pilot, we roll it out, but continuous airing is actually a responsibility of the state. So how have they been coping? What have they put into place to make sure that people, especially now that we're in the cholera season, before now, we at the NCDC have even developed what we call the cholera risk seasonal calendar. So it's already predicted. We work with NIMET. And NIMET, you know, have already told us several months ago.
What about Ministry of Environment?
All.
Who should be at the forefront of this?
Since 2017, we established the National Technical Working Group for Cholera at NCDC. This has a representation from Federal Ministry of Water Resources, Federal Ministry of Environment, National Primary Care Development Agency, development partners, NIMET, NEMA. They're all working with us.
So everybody's involved. Very quickly, before we wrap, I mean, it will be important to know what are the early signs that you need to look out for, you know, to quickly seek treatment.
Well, it's profuse watery diarrhea, what we actually call rice watery stool. Those who come up with these diseases, if you see the stool, it's just like parboiled rice. So profuse watery diarrhea, 3 or more stools a day, so the dehydration, loss of water. And that's why we say, in fact, the early intervention for managing cholera is not even taking the medication.
What is
it? Oral water,
oral
solution, ORS.
Right.
So we advise and also, you know, work with state and local government to establish more oral rehydration points, ORPs.
Right.
You know, you classify these patients as they come, you look at the degree of dehydration. Some just need this ORS and they have gone home. And they are doing well, integrated in society, and there's no transmission. But, you know, delay in actually presenting themselves maybe to the health facility is what we are seeing. If not, if early intervene, you will see that fatalities is reduced to less than 1%.
Great.
And that's the global standard.
And maybe part of the enlightenment too should be to begin to enlighten Nigerians about the need to have a first aid at home. Not many Nigerians know that. And I mean, if you have ORS at home, it's a quick go-to.
Yes.
Right.
Yes.
Very important.
Yes.
Thank you very much for joining us on Newsnight. Sebastian Yennan is Director, Subnational Support Department of the NCDC.